The European Commission is pledging to double its contribution to COVAX, the global vaccine programme helping poorer countries access coronavirus vaccines. The EU's commitment to COVAX will rise to €1 billion. The announcement comes as G7 leaders are holding virtual talks to discuss how to share jabs more fairly with poorer countries. The United Nations has slammed the distribution of jabs as wildly uneven. Just 10 countries account for 3/4 of all vaccinations. President of France, Emmanuel Macron, is now calling on Europe and the United States to allocate up to 5% of their supplies to the poorest nations. Well, the One Campaign, the Global Health and Anti-Poverty campaign group, co-founded by Bono, has looked closely at which countries are on track to stockpile the most doses. It found that the EU, the UK, the United States, Australia, Canada and Japan should be able to vaccinate their entire populations against COVID-19 and still be able to share at least 1 billion excess doses with other countries. That would be enough to vaccinate the entire adult population of Africa. Well, let's get more on all of this. We're joined by two leading researchers. First of all, by Brandon Locke. He's a policy and advocate manager at One, who joins us from Brussels. And also then joining us from Washington is Dr. Farley Cleghorn, the group health director of the consultancy firm Palladium Group. And I say he's in the United States. First of all, Dr. Cleghorn, let's start with you. We've been talking about these stockpiles, haven't we, of vaccines, but frankly, at the moment, no country has got stockpiles of vaccines. This suggestion about distributing supplies is some way down the track.
Yes, good morning, Darren. You're absolutely right. These are what we call commitments from companies to supply to countries who've made these advanced market commitment or purchases. And no country actually has a stockpile at the moment. We have seen production difficulties at the companies that have approved vaccines, and those production difficulties are only now being overcome. One of the biggest issues we have to face is recruiting more manufacturing capacity in developing countries. And we're talking about countries like India, which is already manufacturing the AstraZeneca vaccine under Covishield. But we can do the same in South Africa, as well as in Brazil, and in a couple of other countries as well. We should keep in mind that the fight here is against the virus. It is not between countries.
Let's bring in Mr. Locke on this. Your campaign, the One Campaign, I think is suggesting that when you get to 20% of populations being vaccinated, that somehow that's when vaccines should flow out of those countries to help poorer nations. Are you suggesting that, for example, I think the UK, which has vaccinated more than 20% of its adult population, should now be moving vaccines to sub-Saharan Africa, for example?
Thanks for having me, Darren. Really happy to be here. But that's exactly what we're saying. Like you said, we've crunched the numbers, and we know that there will be 1.2 billion doses left over after the richer countries vaccinate 100% of their populations. So what we need to keep in mind is the big picture here. And the big picture is that 130 countries haven't received a single dose of the vaccine. So, this isn't really about a charity. The science is quite clear that even if everyone in our home country is vaccinated and the virus is still raging in other places of the world, we're just going to see COVID mutate in ways that become resistant to the vaccines that we have. And if that happens, we're back to square one. So we really need to get these vaccines around the world.
Do you at least understand, though, when populations in countries that have bought these vaccines are saying, we want our own people vaccinated first? That's a very natural response, isn't it?
Oh, of course. But I think that's why we need to look at the big picture. And there's a moral argument. The science is also clear that if we don't have equitable distribution, we could see as many as twice as people around the world die because we don't have the right people vaccinated and we're not slowing the virus as effectively as we could. There's also economic arguments. This could cost the global economy more than $9 trillion. But I think the biggest argument that we need to think about at home is that if we start to see these mutations, we might feel safer because everyone in our country is vaccinated. That's not how it actually works. The virus doesn't know any borders. If we have the mutations coming up in Africa or Southeast Asia or anywhere else in the world, and they come back to a country that's completely vaccinated, we're back to square one. We're back to lockdowns. So we need to think about it in the big picture.
So let's bring back in Dr. Cleghorn here. I mean, it is a really tough sell, surely, isn't it, for governments in countries that actually have had a very slow start or rollout of this vaccination process to be suggesting that in the next couple of weeks or months, for example, here in France, that vaccine should be sent outside of the country, outside of Europe. Voters just aren't going to buy that. How can governments convince them?
I think it's a very good point that countries need to assure their populations that they're being looked after. We've seen the rollout of vaccines characterized by snafus of all different kinds, from production failures to inadequate planning for rollout, for addressing vaccine hesitancy, for dealing with operational problems like the weather, such as we've had in the US over the last week. And all of those problems add up to a sense of anxiety that we aren't doing well enough to help others. This is, in fact, not the case. As my colleague has pointed out, in the case of a global pandemic, you actually are not protected unless most of the world is protected.
And so when we talk about unless you stop travel,
unless you continue to lock down, unless you continue to use very blunt measures that aim to control spread of the virus. So getting back to normality is going to be much longer unless we take a world view.
And Brendan, just on that worldview, I mean, there's a sense, isn't there, that in the wider scheme of things, we are seeing not just a vaccine race, but an attempted vaccine influence. And how do you feel in your organisation when you see Russia and China, whose vaccines haven't gone through the same diligent processes as some of them have in Western Europe and the United States, that they are sending these vaccines out to many parts of the world? I think it was Ursula von der Leyen who suggested earlier on this week that she found it odd that Russia was sending vaccines abroad when they hadn't really vaccinated very many of their own populations. Is that of concern, or is it to be welcome?
Well, I think the geopolitical argument always is going to come into play when you look at why certain countries are doing certain things. But at the end of the day, getting vaccines out the door, initial doses, before the entire population of those countries is vaccinated is essentially what all countries need to be doing. So I think it's very easy to get drawn into the politics and the geopolitical situation of it all. I think what we need to be focused on is the health argument, is the health aspect, and that's we need to end the pandemic as quickly as possible. And I think that the EU started off this pandemic, the European Union started off this pandemic with a really strong message on global leadership, on global solidarity. And I think right now, in perspective, they are falling behind in the big picture. So I think that what the richer countries need to be doing, what the G7 countries need to be doing today when they meet, is to look at how can we put together a comprehensive plan to sort of do the same thing. Motives aside, it's about ending the pandemic as quickly as possible.
Okay, fascinating debate, and one I assume is not going to end anytime soon. Brandon Locke from the organisation One from Brussels, and Dr. Farley Cleghorn, who is joining us from Washington, D.C. with the Palladium Group. Thank you very much indeed for both joining us this afternoon. Time much appreciated. Thank you.